Let's dive in here. Let's talk about lab work. So we've had a lot of questions around this as I'm creating the course, and concerns and just questions, monetary questions, as well as the function and how helpful lab work can be. So let's talk today about, do you need lab work in order to fix your fatigue? But first, for those of you who don't know me, or if you're new, welcome. My name is Dr. Evan Hirsch, and I'm a functional medicine MD, and I specialize in helping people resolve their chronic fatigue, and I'm on a mission to do so. I'm on a mission actually to help 100,000 people resolve their chronic fatigue, and I'm doing that through this group, videos, interviews, my book, which is now a free download on the website and here in the group, and as well as my one-on-one coaching and my online courses, which are coming out shortly. So let's dive in here to this question. Do you need lab work to get rid of your fatigue, to fix your fatigue? So let's back up first and let's look at what it takes to fix your fatigue. So we need a diagnosis. We need to know what causes are causing your fatigue, which, as you guys know, is incredibly complex, because most of the people who come to see me have seen probably 10 to 30 different practitioners where they haven't been able to help them, or they help them a little bit, this works, this doesn't. And reminder, that is because everybody has multiple causes of fatigue, and everybody has different causes of fatigue. Okay, so one person might have adrenal fatigue and thyroid dysfunction and mold, and another person might have Bartonella and heavy metals and testosterone deficiency. So it's really different for different people, okay? So then the first thing that you have to do is you have to get that diagnosis. You have to figure out the causes. Then the second thing you need to do is you have to have good treatments for those causes. You have to make sure that you can figure out what the cause is, and then you have to remove that cause, and then you check again to make sure that you've gotten rid of that cause. Okay? So then how do we find those causes? So a lot of it can be done with subjective experience. So the symptoms that you have, the physical exam, but mainly the symptoms and your subjective experience. A lot of it can be done with that. But unfortunately, there is a lot of overlap. So if somebody presents with a neuropathy, it can be caused, which is basically a nerve issue. It can be caused by numbness and it can be caused by an infection. It can be caused by mold. It can be caused by heavy metals. So in that case, it's incredibly challenging to figure it out. A neuropathy can also be brain fog. So it can be numbness and tingling. It can be pain in the feet, or numbness and tingling in the feet. And it can be brain fog. So anything that's kind of affecting a nerve, shooting pains through the body. So it could be a number of different things. And so I always like to start with the subjective. The first visit that I have with somebody, they don't have all the labs that I want. And people, 90% of the time, they're going to feel better after the first visit. The second time that I see them, they're already starting to see a difference. If their energy was at like a 2 out of 10, with 10 being ideal energy, the next time I see them, it's at like a 3 or a 4. And that's just based off of their subjective experience, where I can glean, you need more adrenals, you need more thyroid, you need more vitamin D perhaps, you need more B12. Let's start the detoxification program. So it's replacing the deficiencies in hormones and nutrients, and starting the detoxification program. So kind of everybody needs that, but it really depends on their symptoms, determine exactly which ones they need, how much they need, and in what form they need. So that's great, and then as we go on, it's then looking at the toxicities and removing those toxicities, which are the usual suspects I talk a lot about: heavy metals, chemicals, molds, infections, allergies, emotions, electromagnetic fields, parasites, dental infections. So it's removing those and making sure that any of those causes have been remediated. Now, and that's where it gets tricky, because that's where the testing really comes in handy. Now, don't get me wrong, knowing what your adrenals and your thyroid and all that sort of stuff is very helpful, and that stuff is more standardized, because you guys are getting those tests through the MyMD lab, or you're getting it through SpectraCell or other places. or through your local doctor. So a lot of those labs can be very helpful. But then it's figuring out what are the labs that you need, and here's where things get more complex. And and also the interpretation of the lab. So in terms of how heavy metals are done, and this is why when the application to work with me asks a lot of these questions, because I always want to make sure that I'm working with the right people. And if people have had their heavy metals done, checked appropriately, their chemicals, their molds, their infections, and they've all been checked the way that I want them checked, and they've all been treated the way that I would have treated them, then I can't help that person. But 9 times or 10 times out of 10, people haven't done all of that testing. And most of the time, somebody is not going to go through a vigorous heavy metal protocol unless they have been tested appropriately for heavy metals and determined that that's the case. I just saw a patient the other day who had really high chemical levels, that we had checked. There are times where I'm working with somebody and they're like, no, I don't have mold. I'm sure that I don't have mold. And we're working with them 6 months, 9 months. No, I don't want to pay $300 to get the mold urine test. Finally, at a year, I'm like, listen, we have to get this test because, when we're not having success with getting rid of the infections, it's because there's heavy metals, chemicals, molds that are causing a problem. So I'm like, come on, let's get these tests, please, please, please. So we get the mold test, and sure enough, there's a ton of mold in their body. And if we had gotten that test initially, we wouldn't have wasted so much time, and they could have gotten better a lot faster. So what I have found is that the people who are most successful get their tests in the beginning. And no, you don't have to get all of the lab tests. You can, once you have an evaluation with a practitioner like me, where you can dial down and say, okay, these are the most important lab tests that you need to get, first tier, and then these are the second tier ones. That's great. You get those tests, but the sooner you get the important tests that you need, the sooner you get better. Now, it's always important to remember that all tests are imperfect. That's right. I said it here. All tests are imperfect. But you have to get, and part of that is because, tests are oftentimes a snapshot in time. They're not a perfect representation of your total body burden in many cases, or of what your thyroid's doing throughout the day because you're just getting like a morning thyroid. But they are incredibly helpful, and you always have to combine them with the subjective experience, with your symptoms. But it's that combination that is so powerful. So I hope this was helpful for you. If you have a comment, please leave one below. If you're watching this on YouTube, please subscribe to the channel and share it away. So thanks so much for watching. Thanks so much for being a part of Fix Your Fatigue, and have an amazing day.